from home, and they're all locked down. So she was in the car yesterday, and she texted me. She took the car someplace, and she said, "This is the first time I've driven." She said, "In over 2 months." And I said, "So you're texting and driving?" She said, "No." She said, "I pulled over." She said,
"Oh, my kids get on me about that."
You'd rise to join us in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, and we have a new console here. What do I hit? Anything?
Nope, it's good to go.
Okay. Good morning, Des Moines County Board of Supervisors. Tuesday, May 12th, 2020. Be patient with me. I'll have to be retrained. I've been doing this on the phone. Are there any changes to the tentative agenda? Meet with department heads, elected officials. Terry Johnson, Des Moines County Auditor.
Good morning.
Morning.
Just to give you an update on the primary elections, so far we have sent 4,580 ballots, absentee ballots out, and we've received back 1,359. Yesterday we got 809 of those ballots, excuse me. And just to remind everybody, 56 of those were not signed. When anybody sends back their absentee ballot that they have voted by mail, there's a little yellow line on there that asks for your signature, and we need that to verify that it came from you and that it is your ballot, because we cannot accept it until it's signed. So the girls were busy yesterday calling people, trying to contact them to give them an option. They can bring it down here, they'll take it out to them so they can sign it, or we have to send them another ballot. So those are some of the options. And on top of that, I just want to remind everybody, when you do send in your request form for an absentee ballot, to request an absentee ballot to be mailed, make sure you sign that form, and then also make sure you mark your party. There's only 2 ballots we have available, Democrat or Republican. It needs to be one or the other. Please mark on there which ballot you want. If you do not mark it, then we assume that you are the party that you are registered under. If you're no party or independent, we can't do that. But if you are already registered as a Democrat or Republican, we will send you that ballot. So we have gotten a few people that said you sent us the wrong ballot. So that's why you need to specify, just to make sure that that is the ballot that you want. So those were just some of the issues that we're having. So other than that, we're staying busy with the primary election.
Okay. Thank you, Terry.
Construction 101 hasn't been doing too good then, has it?
Oh, yeah, a majority of it has been. You just get a few people that, we need a signature on the request form, we need a signature on the ballot when you send it back. So.
Thank you, Terry. Mike Johnstone, Des Moines County Sheriff.
Good morning, everyone. I would say everything is going well at the SO, business as usual. Everybody's healthy. We're maintaining our social distancing within the office. We're still splitting up staff, those kind of things. So fortunately, everything is going well. Calls for service are up, basically domestics and those kind of things. We're seeing more of those. You would expect people getting cabin fever. People may be drinking a bit too much at home, people without work, kids at home, all the scenarios you see around holidays and those kind of things. So, but we're dealing with that. We're doing it fine. I know dispatch will ask when we get a call. We'll ask the parties if there's any sickness within the home, those kind of things, so that we actually do some screening before we arrive. A lot of times by dispatch, if we can't get that information, so we try to keep our people safe. So we are responding to any and all situations out there, and so far so good.
Thank you, Mike. Jackie Meyer, Clerk of Court.
Things are as normal as can be. I'm still splitting up my staff. We screen folks too if they need to come to an in-person appointment in my office. And as Mike said, domestics are up, and as well as mental cases too. There's a lot of application for those. A lot of people have spring fever. But we're anxious to get back to some type of normalcy, whatever that will be and when. But everything's business as usual.
Thank you. Hollengerst IT.
Just keeping busy like always. Nothing really new to report. So.
Okay. Do you want to tell me who's on there? Save Gina and Krista till last, and we'll move that in with that COVID-19.
Rodney Bleasner with maintenance.
Rodney Bleasner, maintenance.
Good morning. We're just busier than if it's possible, busier than we've ever been. And I have an agenda item this morning, but nothing new to report other than that.
We can get a lot of stuff done. There's nobody in your way.
Yeah, it's perfect time for everybody to get some stuff done.
Thank you, Rodney.
Thanks.
Brian, secondary roads.
Brian Carter, secondary roads.
Good morning. Couple updates, I guess. Iowa City Road, they finished the mainline paving last week. We closed Pleasant Grove down to a one-lane road at that intersection with Iowa City Road yesterday. So they did removals on part of a lane, and today they're pouring. So that hopefully be back to basically normal width by the end of the week or early next. So they're still working there. North Gear, they got another chunk of mainline paving done last week. So there's that area where there's houses along there. We're mostly past those houses. Working to the south. Today they should be connecting drives and doing more pavement removal. Tom, I did get a hold of that gentleman out there, met with him, and had a good conversation. So something we'll just keep an eye on as the project moves forward.
Thank you, Brian.
Mediapolis Bridges, I think they're down to one abutment to pour, but they've still got to drive the piling and stuff like that. So otherwise, they are making headway, and maybe next couple weeks start setting beams on one of those bridges. Contract rock haul, we are wrapping up the southern portion of that today. Kind of holding off on that because it's a construction project, so it'll finish, I'm guessing, this morning sometime. And dust control, the countywide dust control, the contractor called and asked to run for a day, and then they'll come back at the end of May and finish the rest of it. So Irish Ridge and 180th got treated yesterday, and part of Beaverdale. And so there'll be more in that last week of May and do the rest of it. Otherwise, I've got an agenda item, and I mean, there's a lot of other stuff going on, but you guys have any questions?
I don't.
Oh,
All right, thanks.
thanks, Brian. Give me just a second. My coffee cup is running a leak.
I would think the vice chair would take care of that.
I was thinking about just pouring it in mine. That's the best solution. Bob can have it.
Terry's got some paper towels. You.
Just pour it in.
There you go.
Go get you a cup.
No, I'll be fine. Thank you.
That lid's not on that side over here.
Well, it's mostly coming to it's joint somewhere. Anyway, who's next?
Got a Kevin for it.
Our competence is being questioned here.
Chris Lee, Conservation.
Chris Lee, Conservation.
Good morning. So last weekend our campgrounds did reopen on a limited basis due to the governor's proclamation allowing the campgrounds to open a week earlier than what was originally planned. So we opened up all of our RV sites and only 2 self-contained units that had their own on-site restroom facility because we didn't have any of our restrooms open. We do have a phased reopening plan in place, and we are continuing with that now that we have camp hosts established at all of our campgrounds, and we do have the cleaning and sanitization supplies that we need thanks to local health and emergency management. We will be opening all of our campsites this week. So this coming weekend, all of our tent sites will be opened as well. All campsites at all 3 of our campgrounds will be open. Our outhouses will be open. The shower house at Big Hollow will not be. That will not reopen until county buildings are reopened, whenever that turns out to be. So we're basically following the phased reopening plan that's really become a model for most of the state. As far as a phased plan, we've also developed a phased reinitiation plan for our environmental education programs. As of right now, with the Nature Center and all county buildings being closed, we have suspended all of our environmental education programs. We will start those back up on a limited basis, again, when county buildings are allowed to reopen. So when we can open the Nature Center, that's when we will look at phasing in some of our environmental education programs, and our phases as to what we have and the capacity that we have is going to be based on kind of the state restrictions that are in place, based kind of on group size restrictions and social distancing restrictions. It's all kind of, we've got trigger points built into the different phases there. So we're just kind of playing it by ear and seeing what's going to happen and when things are going to be allowed to reopen. It sounds like we're going to know a little bit more later today when the governor holds her press conference. We were just over half capacity at Big Hollow Campground this past weekend, having just reopened. We had 1 camper at each of the other parks, but now everybody's excited to go camping, and we are creeping up on Memorial Day weekend. So we've already sold out all the reservable sites for Big Hollow for next weekend. We had sold out Memorial Day last November, December. So those sites have been sold out for half a year. So for the next 2 weekends, all of our reservable sites are full at Big Hollow. Starting today, our walk-up sites will start filling up, because today is the earliest that you can take a site and have a site for Memorial Day weekend, because we have a 14-day stay limit. And so if you get a site today, you can stay through the Tuesday after Memorial Day, or Memorial Day itself would be your cutoff. So we will have campers pulling into the park all through this week, just so that they have a site for Memorial Day weekend 2 weeks from now. So that's fun. We have a new kayak launch dock at Big Hollow. This was a grant purchase dock that we got. We just put it out. We've still got a little bit of finish work onto the approach to it, but it is out. It is functional. It's been pretty popular. It's right down below the camp host, right next to that fishing jetty that's right below the campground there at Big Hollow. It's got one of those deals that you can sit your kayak on, and it kind of sits right at water level, but your kayak doesn't float. And then you can use the paddle to kind of hook on these parts of the dock, and then pull yourself out into a floating position, so that you can load and unload with the kayak being stationary, and it's not kind of bouncing around and flopping side to side when it's just floating in the water. We've seen them at some of the other state parks and county parks throughout the state, and they're really pretty slick. Folks really like them. So we've got one of those out there. So that's a nice addition to the park. Fishing continues to be great in the lake, judging by the 40 and 50 boats we see there every Saturday morning. And interestingly, the DNR just did their biannual muskie release yesterday. Every other year, they stock 1 muskie per 2 acres within the lake there. And so they did that release yesterday. I've actually heard of 2 muskies being caught out of that lake yet this spring. One was 39 inches and one was 41 inches, although these are fishermen's stories, so you never really know. And then lastly, I need to remind the public that Stars Cave is a state preserve, and is therefore a non-consumptive use site. So you cannot remove anything from that park or from that property, including mushrooms. We've had a lot of mushroom hunters in there. We've had some issues with that. And then we've also had some issues with people trespassing onto adjacent private property. We've gotten a number of calls about that. So I really need to ask that people please respect the property boundaries there at Stars Cave. That's certainly been one of the most popular spots, being that it is so close to town. It's got the really great trail system, and the creek that runs all the way through it. We've got a lot of people stomping down in the creek, and that's great. We want people to come and visit the park and be out on the trails and be outdoors while keeping social distance, but just please respect those property boundaries and the park rules as well. So I think that's about it for today.
Thanks, Chris.
Doug Irvine, Des Moines County Jail.
Doug Irvine, Jail Administrator.
Good morning. Everything's going pretty good out the jail. Everybody's healthy. Population's right around that 66 mark. We do have 5 to 6 people that are awaiting to go to prison. I just got off the phone with Delbert Longley, the state jail inspector, Friday, and he's saying it's looking like early June before we can get our people in there. So we got a little bit of a wait, but at least there's some light at the end of the tunnel there. We also have 3 or 4 that are awaiting residential facilities. They're accepting people at this time, but there's just a backlog is the reason for the wait on those. Other than that, we did get our video visitation up and going, and that's working extremely well. We're very happy with that. Eliminates a lot of movement of inmates and gives them some more phone time, video time with some people from even out of state that they can talk to via the web. So that's going good, along with a little bit of revenue that's generating. Other than that, everything's going good out here. At least everybody's healthy.
Speaking of revenue, I'm going to assume that the Department of Corrections is not reimbursing counties for holding those prisoners for them?
No.
Actually, that's incorrect. They are reimbursing at $50 a day. Now, we haven't seen any of that money, but we did get word that they are reimbursing.
Checks in the mail.
Yep, the state's here to help. But yes, we did get information that they will be reimbursing the cost since they have this delay.
Okay. Thank you, Doug.
You're welcome.
Ken Hyman, Community Services.
Ken Heinman, Community Services.
Good morning.
Good morning, Ken.
Everything's going well at Community Services. Tomorrow, the SEAL morning stakeholder meeting has been canceled, but the governing board will be meeting tomorrow at 1:30. And we're just keeping busy. Nothing more to report.
Is the advisory board meeting tomorrow?
I'm not on either one of those boards. I assume they are still meeting. I just got an email. I got an email that the 9 o'clock meeting was canceled for the stakeholders.
I think the advisory board is canceled. They didn't have it last month, and I got the agenda and stuff for the governance board. So.
Oh, okay.
Thank you, Ken.
Thank you.
Jared Lassiter, Land Use.
Jared Lassiter, Land Use.
Land use been pretty average lately. I think we've had a fair amount of new inquiries, nothing too substantial. We do have a couple of subdivisions that are now out for review, minor subdivisions. It's been kind of a logistical challenge communicating with folks during this current situation. You kind of gain a new appreciation for that initial face-to-face interview and just as an opportunity to explain the process, because I think when you communicate over the phone, there's a tendency to kind of nod along and feel like you're understanding it at the time, and then you go to look at the application later, and then you get confused. And so we've had to follow up to make sure things get where they're going. But those 2 that we've been waiting on are now out for review. So and we expect possibly another larger subdivision to move to the final plat stage fairly soon. Just waiting to see the final there. Apart from that, we're working on the finishing touches for the hazard mitigation plan, getting all that data updated, and hopefully have that sent out for review to FEMA shortly. So apart from that, I don't have anything else to report.
Thank you, Jared.
Janelle Nelly Longquist, Des Moines County Treasurer.
Allie Longquist, Des Moines County Treasurer.
Good morning. We just remain to be very busy as we continue processing registration renewals and title transfers that we've received from the mail and the Dropbox. And of course, the phones ring nonstop. But unless something changes with the governor's press conference today, just a reminder that March installment tax payments can continue to be paid through May 27th without interest, and registration renewals that were January, February, or March and April can be paid through that date as well without penalty. And the 30-day deadline to apply for title and registration has been waived through May 27th as well. So unless we hear something differently, those dates, that date still remains. Otherwise, we just continue to be busy and nothing more to report.
Thank you, Janelle.
You're welcome.
Lisa Schaefer, Des Moines County Attorney.
Lisa Schaefer, Des Moines County Attorney.
Good morning. We're fairly quiet, which I guess is relative. Crime has not taken a complete COVID vacation. We are seeing an uptick in fairly significant drug arrests, as well as domestics. Right now, we're just working on discovery and getting ready for June 1, when we will begin to hear bench trials and other non-jury related proceedings. And then by the middle of July, we're hoping to get going on jury trials and start to clear out some of the docket and get back to normal.
Thank you, Lisa.
Natalie Steffner, Des Moines County Recorder.
Natalie Steffner, Des Moines County Recorder's Office.
Good morning.
Good morning.
We too are just keeping busy with the phone calls and the mail. I'm sure, like most others, we would love to see everything reopening. It's a lot easier for us to be able to help customers face-to-face or over-the-counter, especially with all of our boat transactions that we're working on. But we're just making it all work and ready to reopen.
Thank you, Natalie.
Angie Vaughn, Safety.
Angie Vaughn, Safety.
Good morning. Can you hear me?
We can. Good morning.
Good morning. I really don't have anything new to report. We're just keeping busy. We are seeing a little bit of uptick in activity in our department, but nothing major. So just keeping busy and trying to keep things going. Other than that, we're good.
You weren't able to listen in last week's meeting, so I don't know whether you heard or not, but the county got its safety dividend from the workman's compensation and got $28,500 check about a week ago.
We like hearing that. We've got a lot of great people that do a lot of things to help out with that.
Great employees and a great safety committee and a great safety person. So thank you very much.
Thank you.
Gina Harden, Emergency Management.
Gina Harden, Emergency Management.
Good morning.
Good morning.
As Jared mentioned, we're still finalizing the hazard mitigation plan. I am submitting an extension for that so that we can have a little bit more time to get it to all the cities and the participating agencies to review that. I'm hoping to get that submitted today for that request. Regarding COVID, Krista, Tammy, and I did an online meeting with the Greater Burlington Partnership yesterday for businesses to give them a few resources as they begin to open, and we think that went really well. We're still getting lots of questions from entities and various individuals out in the community when it comes to COVID, so we're doing our best to get responses to them as quickly as possible. Like everyone else, we're waiting on the governor's news brief today to see what she will open potentially for us after a Friday. So time will tell. The farmers market here in Burlington, I understand, went really well this past week and with their opening. So I'm glad people that are attending are following the rules, wearing their masks, keeping their distances, and etc. So that's exciting. I think people are excited about being out and having that opportunity. The personal protective equipment orders have slowed down a little bit, so we're not getting quite as many of those, which is a good thing. That means that the agencies are ordering their own, so that is always a good thing. And we also got a notice from the state that when it comes to the personal protective equipment for elections, they have a plan in place of distributing those to various DOT garages. And I'm not sure how they're getting from those garages to the local counties, but they must have a plan in place to make that happen. And they're supposed to be delivered by May 20th. And it's possibly Terry knows more about that than I do, but that process is set to happen. And that's all I had, unless there's questions for me.
Thank you, Gina.
That's all I have.
Krista? Okay, Gina, is Krista at the EOC? Is the EOC open now?
Oh, we are not.
Think it is.
No, we are not open today. We're open Monday, Wednesday, and Friday this week.
Okay.
There's a couple phone calls on here. I don't know if one of those is her. I haven't talked to her yet this morning.
And
excuse me.
That's fine. I didn't think it was open.
Hello.
Krista?
Yes. Can anybody hear me?
We can. Good morning.
Oh, hi. Sorry, I called in this morning. I was having trouble with my computer, so I just called in by phone. So we currently have 40 positive COVID cases according to the IDPH website. Our public health continues to be busy. We're doing case investigations and contact tracing. What we try to do is anyone who's positive for COVID, we try to reach out to all the contacts they've had within 2 days prior to a positive test, or up to 10 days from the time that the test was positive. So we're very busy with the contact tracing, trying to make sure people are self-isolating. Like Gina mentioned, we had that call yesterday with Greater Burlington Partners, and just working with the community. I think there's a lot of anticipation that today the proclamation will release or take down some of the restrictions for our county by the end of the week. So we're just really helping community partners out, and a lot of residents that are Des Moines County residents that are calling and having questions, and just really trying to educate themselves on how to be safe when things change. So I continue to work on the public assistance grant. I think we've got that just about wrapped up. Transitions continues to house some of our homeless population at this time, and so we continue to work on that grant, trying to get that finalized.
Thank you, Krista.
Thank you.
I guess I'll throw it in there without into any numbers. So, but that emergency operations center, when Tammy from the hospital there, the hospital has never been pressed anywhere near pressed for capacity. They have plenty of excess COVID-19 capacity. I would be correct in saying that, wouldn't I?
Yes, there is a lot. Yeah, we've not had, I believe it's 28 beds, and we've been nowhere close to even 25% of those being filled, so.
Okay.
Krista?
Yes.
You have a program for cutting elderly's toenails, don't you?
We do. We do have a toenail program. We do clinics, toenail clinics, that we go out and we set them up at a lot of senior homes or different sites in the community. We've not been doing those since the COVID outbreak, because obviously we get quite a few people to come to those. But we do those by appointment. So if someone needed individual toenail cutting, they could call our office and we could set that up for them. We do that through a grant through Milestones.
Yeah. You don't have any barber shears, do you? I could use them.
I don't think you'd want any of us to cut your hair.
Okay. Might want to talk to Mrs. Broker. You might not be really pleased with the process.
Thanks.
Thanks,
You're
Krista.
welcome. You're welcome.
Either of you gentlemen have anything?
No, that's it. I just
Yeah.
had somebody ask me about that.
Yeah. And I didn't bring this up at the beginning of the meeting, and I apologize to be retrained. If you're watching this on your phone or your computer, the county website, and you have any questions or you want to make comments during public input, you can either email the Board of Supervisors at board, B-O-A-R-D, at dmcounty.com. That's board at dmcounty.com, or call 319-753-8203, extension 4. That's 319-753-8203, extension 4. Either of you gentlemen have any correspondence?
I have
I have none. We have an engineer's report on the bid results for the Des Moines County Highway 99 bridge. We've been talking about that bridge for 5 years at least. And I finally took bids on it, Brian.
Longer than that. Yeah, we took bids last Thursday, had 4 bidders, good competition. So our low bidder was Iowa Bridge and Culvert. Happens to be the same company that's working on the Mediapolis Road bridges. Their bid was $2,395,936.85. And 3 other bidders, the next closest was about 20,000 higher. If anybody needs those, I'll send them to them, but I'm not going to go through all the numbers. Engineer's estimate was somewhere around 2.9 million, which we hoped was high, clearly, but you don't ever know for sure. But looking at this competition, I'd say we hit the market at the right time, I guess, which is good for Des Moines County taxpayers. So, reminder: this project, they can't close the road until November, and then they'll have some free winter work. So the project will string into next year, and in all likelihood, it'll be closed through the winter. But I suppose a contractor could just wait till spring and work in springtime if they wanted to. I don't expect that, though. I have not talked to Iowa Bridge and Culvert to see if they have plans yet or not. We'll work on getting contracts together and get those onto the agenda at some point in the future.
Thank you, Brian.
Yeah, no problem. Thanks.
Needless to say, I was quite cheered up to get a bid of $500,000 under what we had anticipated. So,
well, if you go back a little bit further, if you remember, at the very beginning of this, when Burlington Waterworks was looking at doing a separate bridge beside it, basically, which was a custom design and custom work, we were looking at a not to exceed number of 5.4 million at one point. And that was inflated even at the time. We knew that was more for the bond paperwork and stuff like that. But it's good to get to this number. I think this is a very competitive and a good number.
Yep. I was very pleased with that.
All right.
I'm sure I speak for the board. Thank you, Brian.
Yep.
Rodney, excuse me, Rodney Bleesner.
Do we need a vote on that?
Quote approval for the courthouse chiller.
Yeah, this is something that's in the budget actually for next year, but there's such a lead time on parts, so we're trying to get ahead of the game and get the quotes in. So I received 3 quotes, and we would propose to go with Arnold's Refrigeration for a Dakin unit for the price of $50,578. I think we had a little more than that budgeted, so we're under budget for that project. So that's what we would propose.
Thank you, Rodney.
Approve.
Second. Terry?
Jim Carrey,
Yes.
Bob Beck,
Yes.
John Broker,
Yes. We have personnel actions. We have 2 personnel actions for the Correctional Center. We have Alexis Abney, part-time correctional officer, a resignation. And Alexander Elliott, a part-time cook, a part-time assistant cook promoted to part-time cook. The previous rate was $10.63 an hour. The new rate is $13.08 an hour.
Move to approve. Second.
Terry?
Bob Beck,
Yes.
Jim Carrey,
Yes.
Tom Broker.
Yes. We have a personnel action for local health. Ari Kramer, a secretary, unpaid leave of 78.46 hours for the pay period 4/19 through 5/2.
Move to approve. Second.
Terry?
Bob Beck,
Yes.
Jim Carrey,
Yes.
Tom Broker.
Yes. We have a personnel action for the sheriff's office. Alfred Waterman, deputy, discharged.
Move to approve. Second.
Terry?
Jim Carrey,
Yes.
Bob Beck,
Yes.
Tom Broker.
Yes. We have reports. We have the general assistance monthly report for April 2020. The recorder's report of fees collected for April 2020 and the sheriff's monthly report for April 2020. These reports will be on file at the auditor's office and available for electronic review at the public's request. We have minutes for the regular meeting of May 5th, 2020.
Move to approve. Second.
Terry?
Bob Beck,
Yes.
Jim Carrey,
Yes.
Tom Broker.
Yes. Any other business?
Have none. I have none.
I have none. Future agenda items.
I have none.
Committee reports.
I had a early childhood meeting by Zoom, and we reviewed 5 new RFPs, and we accepted 2 out of the 5 at this meeting. We're reviewing the other 3, but I'm happy to say that one of them is for the Burlington Community School District to help with the early childhood ages 0 to 3 and then 4 to 5. So it's going to be over at Core School. They're going to have it over there, and I'm kind of excited about that because it's going to give the schools got a good program set up for them. I think it's going to help these young children, and that's what it's all about. Take care of these kids. So.
Good.
Yeah, I attended a telephone conference with the Conservation Commission, and you heard Chris talk about most of it. Chris released $133,000 of trail funds if you fellows remember right, they were in here, him and Zach James were in trying to come up with projects for us to use that. It had a 20% match, but the projects they came up with were generally 100 or 200,000 higher than that. So we had rejected them. He turned them over to the city of Burlington. That should finish their portion, I think, or come close to finishing their trails. So he can reapply for the funds. Their original intent was to use it to buy the ground that was going to take to finish the trails, and that didn't happen. That didn't work out. Also, Chris mentioned that they came down, went through Stars Cave, and I believe it started, maybe it wasn't. Chris, you still on there? Talking about the largest oak tree in the state of Iowa. It happens to be on Chris's.
Yeah,
park.
I'm on here. It's the
Where was that oak?
on the Leopold Recreation Area. They're east of Stars Cave at the end of Mill Dam Road. It's kind of down. It's kind of back in the hinterlands. Kind of back below North Gorge Trail. You actually take North Gorge Trail to get down to that bottom where it is. It's on the north side of the creek, but it's the largest chinkapin oak that they know of in the state of Iowa. Kind of neat.
How big is it?
Let's see if I can remember right here. So it's weird the way they do it. They measure circumference, but it stood, I think, 80, I want to say 80, about 85 feet tall, and had a crown of about the same, 80 something feet in crown. And then the circumference, I don't remember what that was actually, but it's big. I don't think 5 people with locking hands could get around it.
It is big.
Big tree. Thanks, Chris.
Yep.
Chris got a new plan coming. It was not going to be a new one because of the virus and the work schedule in the plants changed on him. So he needed a van. He went and got a van off the lot. So went well. Had a good meeting and a lot of conversation on the telephone. I was impressed.
I've been attending the Emergency Operations Center meetings most afternoons by Zoom, and Des Moines County's holding its own. Like Chris had said, we've never come close to using many of the hospital's resources.
Yeah.
And we've got a few cases pop up. Apparently, a lot of it's just household. If you find a household with somebody positive in it, you're very likely to find another one or two if you get people and live together like that. So
If they tested everybody, they'd find a whole lot of them.
Probably, I don't know. That's what you read. You get asymptomatic. So yeah, I suspect that's true. When you have limited resources and limited lab time, interpreting those results, you have to prioritize.
Maybe it's not the same, but whenever a farmer has a disease in his hogs or cattle, call the vet. The first thing he does is checks their saliva or their blood, see how sick they are or what they've got, and then he knows how to treat them.
You should email the Iowa Department of Public Health.
Well, I'll let my vet do that.
Public input. If anybody from the public would like to address the board or make a comment, you can email the Board of Supervisors at board@dmcounty.com or call 319-753-8203, extension 4. We will wait 2 minutes to give anybody a chance to make that call.
Two-minute warning. How was your stay at home?
It was fine. My wife I think I told you she'd been in Florida for 2 months with our daughter and son-in-law, and they're working at home, and they have 2 little kids, a 1-year-old and a 3-year-old. They're just as ornery as their grandmother. So I don't know what you do with them. So she's been locked up for one. Then when she got here, we had to self-isolate for 14 days. And yeah, we finished 14 days at about 3 o'clock yesterday afternoon. Mrs. Broker took a ride. She texted me and said that's the first time she'd driven a car in over 2 months. And I said, "You're texting and driving?" She said, "No." She said, "I pulled over."
And when you talk ornery, I knew their great grandparents. That could rub off.
Might be.
I had somebody ask me about that. They was gonna have that toenail clinic again.
Huh?
It always amazes me. That's part of their, what they do to go out and do that.
I remember Barb telling me that.
I was gonna say, if it was you, I'd go get a hatchet and a block of wood and get rid of them in a hurry.
Yeah. Permanent, huh?
Yeah. Can I go ahead and
So-
leave? And
2 minutes are up. So with an aye, we will adjourn, and we will take a short break
it's good.
before the work session.
I need a short.
Okay, we have a work session regarding the resumption of non-jury legal proceedings at the courthouse. I believe that's scheduled to occur on June 1st. And let me preface this. I don't think it's the board's intention to change. The county's already providing the services from the auditor and the treasurer and the recorder, and doing that online or by phone, or you can call and make an appointment if you need to do it. I don't think we need to. That's going to change right away, but we need to make accommodations in what we need to do for these non-jury proceedings. And so we have Chief Judge Mary Ann Brown here, and thank you for coming.
Thank you.
And Clerk of Court, and I know Lisa Schaefer's on there, and so what does this entail?
Well, we've been, right now, our clerk of court's offices are operating pretty much like your county offices are, where nobody can come in unless they make an appointment or come to the front door and the clerk verifies they should be in the building. That's for working in the clerk's office, or if there are a few cases that we have in person. Very, very, very few, but we do have a few. And we've been directed by the Supreme Court and State Court Administrator that we're going to maintain that same operation until June 1. So for the rest of May, we will not have people just coming in and ask for court proceedings. So if you keep the front door locked till 1st of June, absolutely no problem. So there's no, for the rest of this month, we will continue like we are. After that, on June 1st, we're going to start having in-person criminal proceedings. Generally probably be court service days, where people will be able to come in person. But we also are still going to keep doing video conferencing and television as well. So not everything will be in person. And starting June 15, we can also start having civil matters like divorce cases or probate matters for in-person hearings. But we also will still be doing video and telephone for some of those as well. Right now, trials are not set to start until
July 13th for jury trials.
Jury trials. And everything is subject to change. None of us know what each day brings on this. The Supreme Court has created a fast-track task group to study how we might do jury trials to accommodate the concerns and needs of jurors, bringing them into a confined area. And that group is starting its work right now, and they're supposed to have the report back to Supreme Court by early June. So we won't know exactly how we might function for jury trials until sometime in early June. And individual people coming to the courthouse would be 1st of June. So I don't know what your plan is about opening doors. But
This is the courthouse. We're going to make it work, you guys. So when you have those non-jury legal proceedings, and it's not, how many people, I mean, you have lawyers, I assume, and judges and defendants and.
The judges, and it'll be primarily court service days, but there also will be juvenile court days and traffic days. And we just don't know how many people will physically be coming in the courthouse, because some people still may want to do them by video. And if they're in jail, we can do them by video. We've been doing that, and we do the go-to meeting thing with the jail, and I have a feeling we may keep doing the jail people for quite a while that way, just to help the sheriff not have to be transporting them too. It'll be the people that aren't in jail that would be coming to court. And it's not gonna be large numbers, but it'll be significant, yeah, I mean, it'll be, as long as the governor says not more than 10 people in a hearing or whatever, we're gonna not have more than 10 people in the courtroom, I can tell you that.
What are, okay, court service days, what days are those?
For district court, it's Mondays, and next month it'll be Mondays and Tuesdays.
Mondays and Tuesdays.
And then the district associate judges have a Friday court service day, and then they have during the week other juvenile court hearing days, like on Thursdays and Wednesdays as well. But we, you know.
Is this something to require people coming in and out, or if you're gonna have a trial, and you've got, say you've got 10 people, so would they come in at 10 o'clock and?
On those days, we set things like at 9 o'clock, 9:15, 9:30, 9:45, so that we don't have everybody here at the same time. So there'll be people gradually coming in, is what those would be.
Krista? Are you on there?
Yes.
So we've got people coming in here, it's not gonna be more than 10 in a courtroom, and they'll probably be staggered. I'm assuming if you need witnesses or anything like that, you bring them in one or two at a time?
Correct.
So, do you have any, is that something we would want to maybe take the temperatures of people, or is that a problem, or?
Yeah.
Any thoughts?
Yeah, we definitely would want to screen them as they're coming through the door, asking those questions. You know, they've increased the questions to 3, the respiratory, have you had a fever? You know, do you have any respiratory symptoms? So we want, or shortness of breath, we want to ask those. And then we have the new ones they've included. So we definitely want to do that screening. But I think we could easily go ahead, and Lisa may have some insight on this too, but I think we have those infrared thermometers that don't touch anyone, that we could do it very similar to what the hospital does, have them sign in, have them take their temp, because we're not actually touching them, and then have them just answer those questions.
And I don't know what your plan is, whether you come in the courthouse, I don't know.
I guess I don't know. I certainly didn't think probably the treasurer's office and auditor's office, they seem to be getting along fairly well. Would that be?
Because of the June primary coming up, we have been so prepared for that, being shut down, doing everything by mail. I would not want to open my office up on June the 1st. I would wait till after the election before I open, because then you got people thinking they can come in and vote in person, and it would just totally confuse. And we still have to prepare our office, because we don't have the guard up, and we need to address, if you're gonna let people in, you're gonna screen them, are we gonna have somebody at the front door, we're gonna have somebody down the handicap door? Who's going to be cleaning up after somebody comes in? Is each office gonna be required to do their own wiping down of the counter and everything else? I mean, there's lots of things that and the social distancing, we don't have the posters set up, we don't have the markers on the floor, which we can get the painter's tape and mark off our own, but through Jackie, we have ordered a lot of the posters and the markers to put on the floor, and I asked her to order enough so that we'd have some for all the other offices to put in, but we haven't gotten those yet either, so there's lots of things that we've ordered and checking on that we just haven't gotten yet.
And I think it would be great if there was one central point of entrance in the building through this whole transition period of when we start letting people in, and maybe that's in the basement, because that'd be handicapped accessible. And if there would be some, once people start, and I don't know how many people will want to have their hearings versus doing it by telephone. You know, we're still authorized to do them by video and telephone. But if there was some person that kind of knew what they were doing to to monitor those people before they came in the courthouse. That would help all the offices on that.
I agree with you. And I think this would be on a limited scale, that would be an advantage when we do want to open the courthouse up a little bit more, you know, is you know, in whether it's a couple weeks or whatever, that this would work good. Krista, would
Yes.
what kind of training do you need, or what kind of to operate an infrared thermometer? I mean, is that something that you could teach me to do, or do you need to be a nurse to do that?
No, I think anyone could really do that. It's literally just hold it there. There's manufacturer recommendations on how to use it. So it's about an inch away from the forehead, press the button, and it reads the thermometer. If you've gone to the hospital recently, they do something very similar. Theirs does touch the forehead, but ours, you don't even need to touch that. And so it's very easy to use. And then you just document who came through. You ask those questions. We could even do a board very similar to what the hospital does. Read these. Do you have any of these? They answer yes or no. And then that person documents it. So I think it wouldn't have to be a healthcare professional.
Okay. Do you think, go ahead.
Whose staff's gonna do that then?
That's what we're about to discuss. What do you, Krista, and I don't know the availability to your staff, but it would seem to me that there might be an advantage to having a public health nurse or somebody like that training at that temperature, so you don't have somebody like me trying to go.
Yeah. You know, if that's something that we wanted to look at, we can definitely explore that. We can see if we can find someone that, and how many hours a day are we looking at? Would this be 8 hours a day, or is this more scheduled for these hearings?
Well, theoretically, on a Monday and a Tuesday, it'd be all day long. And on a Friday, it would be through noon anyway. I mean, part of the problem is too, we've been backed up for, 2 months, so we could be busier, or we may not be busier, we just don't know. But it wouldn't be all day, 5 days a week.
Tuesday, that we could keep those things,
Yeah, I think this is definitely something that we could work on with our schedules and see what we could do to help out. We also have CNA staff, certified nursing aides, and so I think, between nurses and our support staff, we should be able to do something with that.
Okay, I think, well, at least starting out, people would be more comfortable if you did have somebody, some health knowledge to do that. So, that'll be, I'll tell you what, we'll maybe,
maybe we could contact SCC for their nursing.
well, and it might be, Krista thought they might be able to come up with people. We could do that, but
Good idea, student nurses.
Krista, what we'll probably do is maybe have a Jackie or one of the judges contact you and get an idea. Say, it's going to be all day Monday and Tuesday, maybe half a day Wednesday, whatever it might be, and sort of work out a schedule.
Okay.
How would that be?
Yeah, that'd be fine. Currently we're not doing any homemaker visits because we've kind of scaled back. Because, a lot of people are not wanting anybody to come to their home. So at this point, we definitely would have, staff be able to help with that. That'd be great.
Well, I think that'd be great. Like I said, a soft opening. I think we'll learn some things doing this just a little bit, for when we open it more up. So, what do you need at the jail? Well, they can get video training at the jail, so.
Yeah, we'll be okay on video, obviously, but even if we have to bring somebody down, we'll still be okay with doing that. If we can stagger it enough, the ones that show up in person to maybe stagger a little bit more, so we just have time to relay back and forth. But yeah, we can make that work out fine.
Because you won't be transporting anybody together like you
Correct,
used to do.
correct.
So the
For Tuesdays,
Right.
so.
the 77 counties that are been open, have the court system's been working there?
No, the court, and that was a discussion we had probably 10 days ago with the Supreme Court. And the question was whether we would have court services open by county or statewide. And they made the decision we do it statewide so there wouldn't be confusion. So even in the 77 counties, the clerk's offices are still closed and just operating by appointment and no in-person court hearings either.
And I think a lot of those courthouses are still doing like what we're doing, appointments only, they haven't fully opened.
But there's some that are. Wapello
Yes.
County's standing wide open.
Yeah,
That's someone.
some of them said that they just flew the doors open
Yeah.
and they aren't prepared, and some of them are just having fits, but.
Rodney?
Yeah, I'm here.
Okay, you and I had mentioned this once, and you were concerned about outside at the stairs there. You've got a little hand sanitizer dispenser.
Yep.
And I don't know what your access to. Would it be possible to get something like that if we have a one entrance, if it was in the basement or something like that, so that people coming in could use hand sanitizer?
Down there. Yeah.
Is there one down there now? Okay.
Yeah.
Okay.
Yeah, we got one on each floor. There's ones with stands. The only problem is the hand sanitizer that it's in those. That's all we have because everything's been back ordered for months. I can't get any more, so what's in there is what we have. There's some on the walls too. That we have some in there. We have some other hand sanitizer, but as far as the ones with stands that are hands free, what we have in there right now is all we have. Just a couple other things to add. Like Terry said, we don't have any signage yet. We will have to look at the elevator. There's about 6 feet in there, so you'd only be able to have 2 people on the elevator per time, in there at a time. Lots of things like that, and we don't. Right now, the courthouse gets cleaned at night, so if you're having more people in here and wanting something more disinfected throughout the day, we'll have to look at maybe bringing somebody in during the day to disinfect as well.
And Rodney, I've told the judges and the clerks, we've talked about this, that we're gonna have to take some responsibility ourselves in between court hearings if we have 5 court hearings in a morning. So court administration is attempting to get spray sanitizer and more hand sanitizer and wipes so that we can spray down chairs and tables in the courtrooms after people leave from hearings. And so I've told judges that they're gonna have to take on some responsibility for that, like court reporters, court attendants, and clerks as well. So anything you do on top of that, we will greatly appreciate.
Okay.
And
Yeah, and what?
sanitize.
Sorry, if you do have one of the doors open, there will be. I mean, there's a lot of people that want to get in right now, or that stand at the door and call for appointments and whatnot. So, I would encourage. It sounds like you are going to do just a one entryway. I think that would be good. Also, right now, the public lawyers do not have access. Normally, they would have access to the building as far as their key fobs, getting them in and out. So that would be another thing to look at. I would think we would want to keep it the same way it is right now with them not having access. So that way they'd have to go through the same door and the same procedure as everybody else through that basement entry.
I agree, Rodney, absolutely, yes.
That's all I have. Thank you.
I was gonna say on that hand sanitizer, this winery up there by Cedar Rapids is making that stuff for and for the counties there, like the hospitals and that. So
I think it's liquid though.
I did receive some.
Huh?
Yeah, it's just a liquid, but it's still.
Spray,
yeah.
That's
More like
it's not
rubbing alcohol.
it's not the gel.
It's not what's Purell is what he's got out here, and they have special bags
Yeah.
that it's filled with, so.
Yeah, you get different kinds. You got the liquid kind, some you can put in like spray bottles and spray it on. Then you have the gel kind, and then you have the foaming kind. So the ones that are in the stands, special bottles, they're a foaming. So when it comes out, it's more of a foam when you spread it around. So I mean, there's lots of different hand sanitizers out there. Just the stand ones we have in the hallways, those are the foaming kind, and those are the ones that I can't seem to find everybody's out of and back ordered. So, but there is other options. There's other hand sanitizers, gels, and sprays and stuff that could be used if we run out of that.
Tom,
Thank you, Rodney. Yes.
local health and emergency management bought some of those from that winery in Cedar Rapids. We bought some gallons of that hand sanitizer. It's liquid, but we did have it bottled in the 8-ounce spray bottles to make it easier to use. So we do have that available.
Okay, thank you. We're talking about having one door open in the basement, having somebody from local health there to ask the questions and use that infrared thermometer. And we wanted the other department heads, the recorder and the treasurer. We aren't counting on changing any of what if somebody needs to get in, same as they do today, they can call and make an appointment. We're not counting on people coming in that door and saying, well, as long as you've got the door open, I want to go to the recorder's office, or I want to go to the chat. We aren't going to do that. They will be in here for coming in for court proceedings unless they've made an appointment. If they've called the treasurer's office and said, I need to come down for this or that reason, that's fine. That we will handle that just exactly the same as we do now. Is that everybody's understanding?
And I think you could leave the door locked.
Oh, I think it did, whoever's,
Yeah.
just,
Open it every
yeah.
time. Yeah.
Nope, I agree. I think that's good.
Just to clarify real quick, is that door still gonna be accessible at the alleyway for key fobs for transport officers to bring inmates in? We will screen them out there, and employees get screened when they come to work. Just to eliminate having.
No, I understand.
Yeah.
Rodney?
Yeah, I'm still here.
Can you hear Doug? Jail administrator?
Yeah, the jail staff still has access to those doors, so that would be a thing that you'd have to figure out if either they pre-screen themselves out there at the jail before they come down and they can just come in the back way just like normal, or whether you would want to have them pre-screened here. We'd have to look at that. The other thing is too, let's say you have 10 people here for a court and they come in that basement door. A lot of times those people will just go out the front door. So, and there's a lot of times there's people standing at the front steps. So you may get people that have come in the bottom door, but exit the front steps and then let somebody else in that's maybe standing at the front steps trying to get in. So we'll have to look at something there, either to make sure to let everybody know that they need to exit, back down in the basement, or not to let anybody in if they go out the front, or also have somebody stationed at that front door to watch that end of it.
Yeah, we'd want them to leave I'm positive it's illegal to lock those doors from the inside, so you can't get out from the inside.
Yeah, we cannot, fire code, they gotta always be able to go out. It's just one of those situations when you're trying to stay within those codes, but you're trying to keep it kind of locked down for the situation we have. It's just one of those things we gotta work with.
You usually is there security when you have those criminal trials?
Yes.
Is that something that the security officer, when somebody leaves, could see that
They leave the building.
by the right? Well, you're going to want to make sure they leave the building anyway.
Get out, that's right.
So they leave the right. So, could security officers handle that?
We do that now. We escort the folks out.
Okay.
We escort them out to make sure that they have left the
Okay.
building and not meandering around.
Okay, so then it doesn't sound like it's a problem for the jail personnel to come in the back, because you'll screen them at the jail.
Right.
And then bring them in here and you can bring them in with a key fob.
Yeah. Court security would have to be responsible for the getting people out. The transport officers couldn't do that.
Yeah. Okay.
Steve and Mark can handle that pretty well.
Yeah. And I think if you put those barriers across there with the sign, you'd have to blatantly go through it.
But it might not be bad for them to leave that way though, so they aren't congesting down in the entryway. I mean, we just don't want to let anybody else in. I mean, because that poor CNA down there doesn't need to have people going both ways.
Yeah. No, if they've got an officer letting them out, they could let them out anywhere.
As long as nobody else comes in.
As long as nobody else comes in, and that's what the officer would be for. Is
And
to
that's the concern that Rodney has, is that somebody grabs the door before.
I understand that. Okay. Does that Sound okay to you, Rodney?
Yeah, that's fine with me. We'll work with how everybody wants to do it. Like I say, it's kind of a fluid situation. We'll work around everything and do what's best for everybody.
Anybody got any concerns we haven't brought up yet?
I appreciate you taking this approach, because those counties, like I talked about Wapello County, where they just opened the doors, it's kind of unnerving for all of us to think that's what's going on. So I appreciate you taking this approach instead.
I sit on the board with, with a couple of them supervisors, and it doesn't surprise me. Jerry thinks that this is a
A whole
hoax.
bunch of,
Huh?
whole bunch of media stuff, huh? Well, their cases keep rising in Wapello County at astronomical rates, I wonder.
Yes, it is. I just checked ours here. We're still at 40, so.
So right now, all of the county offices will just keep maintaining the way we are.
And that's,
Yes.
if
Appointments only. If somebody does need to come in, they can do it by appointment.
they can make an appointment and say, well, I need to be there at 10:30 or something like that, like you would do now if somebody calls up and says,
That's what we do for our curbside
whatever,
voting. We
right,
go
you
out
do that, and quite, if you're doing that when we have somebody at the door, have them come in that door and they can be screened then too, as long as they're going through there. But yeah, that's actually the reason we wanted the recorder and the treasurer, you know, is we're not counting on changing what you're doing. I think you're providing the services you provide. We're just providing them a little differently. So there's.
And until we get done with this primary election.
Right.
We can review it on the 8th of June. We'll review it then.
Yeah.
So if the other offices wanted to open their windows and have people come in by appointments, they could.
Well, right now they're allowed to make appointments. I mean, if somebody calls in, it's up to the treasurer or the recorder or the auditor, however you're doing it now. If you're saying, okay, somebody with this problem can come in, we will meet with them personally. I wouldn't change that. That's up to that elected official. If they're a little more comfortable saying, well, maybe we could do that. That's been pretty much left up to the elected officials is how you make those personal appointments and decide who needs to come in for that.
But I mean, for opening up besides the appointment things, but I'd really like to get those social distancing signs up just to remind everybody, and the things on the floor that if we do eventually, you know, allow the public to come in, that we have all of that in place. And it's gonna be a little while before we don't know when we're gonna get that stuff, so. Everything's on back order, so.
It'll show up and you won't be expecting it. It'll just be here one day.
Well, Bob will step it off and I'll spray paint it on the ground.
I don't think Rodney wants to use spray paint, but
Tape.
Painter's tape.
Then you gotta stoop over and put that on that spray can, you just stand up.
Okay, if they aren't, I guess, just sort of go through here, we're gonna have the basement entrance. It's the only entrance. Somebody come in and they will, will we have a list, say, you know, 2 people are gonna be here at 10:15.
We have a schedule every day that we can print out.
Okay, you can print out.
The nurse could have, or CNA could have.
Yeah, so somebody could be down there and then they come in, they will be screened, have their temperature taken, and probably should the security guard be there to take them where they're gonna go?
It might depend. Some people might be coming with their lawyers. So if they're coming with lawyers, you wouldn't need to do that. People that are on their own, maybe. Most of them kind of might know where they're going already. Or somebody like his staff too.
Yeah, I mean, they could call up to my office, and the security guard could call, and we can come down and get them and escort them to where they need to go.
Okay.
We've been kind of doing that already, so.
Okay. So, and local health will have somebody there to screen them. We'll get them to where they want to go if they don't know the way. After the court proceeding, then a security officer, or I suppose their attorney, whatever it might be, they can take them to the nearest exit and not let anybody else in.
Yes.
And
I'm not sure we'll trust the lawyers on that. We probably, even if there's a lawyer getting out of the building, we need to make sure somebody gets them out.
Yeah.
You only want so many lawyers in the building at one time. Does anybody have any questions on the phone?
Well, I think we've covered court service day, but I know I have several motions to suppress that are not on court service days. How are those going to be handled?
Very same way.
Very,
People come to that door to get in, and no more than 10 people in the courtroom.
Well, I guess as far as screening, is public health going to have somebody there on Tuesdays, Wednesdays, and Wednesdays and Thursdays in addition, because those are when other judges are setting non-jury proceedings?
Yes.
We'll set up a schedule.
Yeah.
You,
Well, do we actually need to have somebody down there from 8 to 4:30 every day in case there's an appointment from another office that needs
That's probably a good idea.
So we probably need somebody there for the full day, or have 2 people to alternate or something.
Krista,
Yes, I'm here.
would you be able to staff if you needed somebody there all day?
I think we should probably be able to work with that, especially with the schedule. We do have a part-time person who picks up hours, so we should be able to work around that.
Okay,
good.
thank you.
How about committals?
We've been doing the committals primarily by telephone or go-to-meeting, and I suspect we'll continue to do that for the foreseeable future because the hospitals would prefer not having people come in and out to go to the hearings. So I doubt if we do commitments in person for a while.
Lisa, does that answer your question?
Yes, and as far as bench trials for associate court, those generally occur on Mondays. But our victim witness coordinators are usually there, for depending on which attorney is handling them. So they may be able to handle some of this escorting back and forth and that sort of thing as well.
Super.
And so, Lisa, at this point in time, I think we're gonna have to kind of play it by ear about public, because we may just not be able to let public, even though court proceedings are open and public, we just may have to try to control that so that, you know, if there's a victim that needs to be there, that's one thing, but I'm not gonna worry about having the doors open for all of America to come watch it right now.
So press?
The press could come in as long as we keep our numbers down, you know. And the only one press, because then they have a pool for anybody.
I think the only time that would be an issue is if we have registered victims, because they're entitled to be there. But generally, we'll know that ahead of time.
And if there's more than one or something like that, they may just have to set up go-to-meeting for them.
I wouldn't be surprised. We might have to, after a week of this, we might want to revisit it and say, you know, it would work better if we did this, or this works great. Can we, but it sounds like we have a plan here that.
We've got a few days before this is gonna happen, so you think about it and say, hey, that won't work.
And please feel free. You can call any member of this board of supervisors. You have anything, anytime. You don't need, that's your.
I appreciate that open door policy, and I think all of us acknowledge this is new territory, uncharted territory, so we may change it after 2 days. We may, you know, have to.
Well, the courts test it out.
Well, and like Judge said, soft opening. I like that.
We appreciate the phone call rather than sending the sheriff out.
You bet. And I gotta tell you, Rodney has been magnificent through all of this. Thank you, Rodney.
This is Natalie. I have a question.
Open up your office until at least after the 8th.
Yeah.
We'll let the courts figure out, see, the following week we'll review and see how this is what it is.
So, gentlemen, can I ask a question?
Yes, Janelle.
This is Janelle. Just for clarification, so we're going to remain the course through the end of May, 1st of June, correct? The way we are operating right now?
Nothing changes until June 1st.
June 1st, okay.
Well,
Thank you.
And actually, for your office, we don't anticipate anything changing. You decide who you would make an appointment with that actually needs to come to your office, and then the rest of your things you handle over the phone. But that will be your decision as to who makes an appointment in your office that
Okay.
you let people in.
Sure.
This is Natalie.
Hi, Natalie.
So currently we do not screen those if we make appointments. Are you saying as of June 1st, those that have appointments will have to be screened as well?
They're going to be coming in through the same door, the basement door, and we're going to have somebody there that's screening people. So yeah, if you send somebody in, you might want to mention that they will be going through a screener, but that'll be after June 1st.
Okay.
Or starting 1st.
Thank you.
Thank you.
Hey, this is Gina. I have a question.
Yes, Gina.
Are you going to emphasize that these people that are coming in should still wear their masks when they come in?
And we've had discussion, I don't know whether the Supreme Court's gonna give us some guidance on that before we get to, June 1 or not, but there's an issue about legally whether we can require litigants in court proceedings to wear a mask or not. I don't know the answer to that yet, and whether we can even require our staff to wear them. Because if you listen to CDC, the whole point is if you stay 6 feet away from each other, then you don't need to have a mask. So, I don't know what the Supreme Court's gonna tell us on that.
Can you suggest, I assume?
Yes, and we have some judges that are gonna say they're gonna require everybody in their courtroom to wear a mask, and I don't know how that'll actually work, but that's. Maybe we can have them down there and offer to them. Yes. If somebody doesn't have one.
That's right.
Yeah.
Can we, Krista, can we come up with masks so if somebody said, I would like to wear a mask, or if there's a mask available?
I think we can see what we can find of the homemade masks, or maybe we'll Google and see if we can find anything to purchase. And I think we could definitely post the sign that the CDC highly recommends masks. It's not mandatory, but that's a high recommendation on their part. So I think we could have that there as well, and then we can see what we can do for finding masks.
And for that first week or so, it's just gonna primarily be us. We have some masks, and
Yeah.
we're getting more. I don't know how many we have, but we have some that we could have down there for
Just
$4.
find some of those disposable
Right,
ones.
those paper ones.
Yeah, that's what they are.
Yeah, it might not, it might be if we had some masks available. I would guess that some people already have a mask. Some people said, hell no, I'm not gonna wear one. And, but if the sign was there that the CDC recommends wearing masks, and, you had one available, or had them available, disposable masks, so. Yeah, that would be good.
So we'll need that kind of a signage and posting down there, whatever the CDC recommends, so that it stands in the wall and wait to get checked in, so.
Ride the elevator up 2 at a time.
Any other questions on the phone?
I'll just put my 2 cents worth in. I don't like masks, especially when you're dealing with people. The facial expression is how they feel. You can't smile at anybody. The only one I can think of that's been in here that could really know it, I've been Cheryl, when her eyes squint because you're spending too much money.
It's sort of like a text. You get a text, you think, is he being smart ass? Okay. If there's any more comments or questions?
Natalie, please.
Yes, Natalie.
So it's safe to tell the customers that still call that are asking when we will reopen. As of now, the county offices do not have a date.
County offices do not have a date. It remains the same. They conduct business over the computer or over the phone, or if they can make an appointment. If the recorder's office says that Sam Smith you know, going to come in for this or that service, you know, you can do that now if they make an appointment. So that is not going to change June 1st.
Okay, so do you guys have a protocol or what? Sorry.
June 1st, they will all have to come in the basement door.
Right.
I guess where are they coming in now?
Already do.
They already do. They will come in through there. On June 1st, we will have somebody there to screen them, to ask them the questions and use that ultraviolet or whatever it is, thermometer, X-ray thermometer, whatever.
Infrared.
But now, if we have somebody that does need to come to our office, we have those 3 screening questions. We don't have a thermometer or anything.
Well, they'll get screened when they come in downstairs. So they'll be screened
before
before
they
they
come.
come.
And then we go down and get them. So.
Yeah, but that won't start till June 1st.
Because I think the volume's different. I mean, right now you have very small volume.
Yes.
Come June 1, we're gonna have a bigger volume, so this idea of more effective screening makes kind of sense.
Yeah.
I was just going to mention real quick to the department heads and that are on the phone still. My ICIT group have been fumbling around some ideas, and one thing that's been brought up quite a bit is some appointment software that basically allows you to give people the option to set appointments online. If that's something you'd like to look into, let me know. Fairly cheap options and some free options that we found as well. So if you want a way to manage that a little better. For making appointments for people or give people the option to make appointments online or however you want to do it, just give me a call or reach out to me and I can, we can look at some different stuff. So that's always an option.
That's great.
And any ideas any department heads might have, people are actually here doing this stuff that said it would work better if we did this or that. Those ideas would be more than appreciated. I think we've got a plan in place. I appreciate you all for taking the time to do this with us, and have a great rest of the day.
And
We're adjourned.
We want to thank the court system for going